Hi, my name is Denise Akins, and I will be discussing elimination, sleep, and skin and foot care of the elderly. So, insomnia, incontinence, skin and foot problems can be the most complex and challenging concerns faced by the elderly because not only do they affect their health, they also compromise their quality of life. There are millions of older adults that have bowel, bladder, and foot problems, but most are reluctant to talk about this condition. Why? Because they're embarrassed. And it's also a major inconvenience that impacts their everyday life. So, as healthcare providers, we must put these conditions on the forefront to better serve our patients. So, first, I'm going to talk about bladder elimination. So, for someone to have a normal bladder, they must have an intact brain and spinal cord. They must have a competent lower urinary tract function and have the functional ability to use the toilet. But as we age, the body changes, which includes the bladder as well. So we have incomplete emptying, increased irritability, and bladder contractions. These changes may lead to frequency, nocturia, which is having to get up in the middle of the night to pee a lot, urgency, and it increases the vulnerability of infections of the bladder as well. So urinary incontinence is a common problem of the elderly. This is involuntary loss of urine that is sufficient enough to be a problem. So there are risk factors for UI. These are cognitive impairment. This is someone who has altered mental status. Limitations in daily activities. These are people who cannot perform their daily activities on their own, such as bathing, cooking, going to the bathroom. And then we have those that are institutionalized, those that are in nursing homes and rehabs who have to call for assistance and aren't able to get that in time. So there are different types of UI. This includes urge, which is pretty much an overactive bladder. When someone senses the urge to have to go, they have to go right away. And then we have stress incontinence. This is caused by activities that increase your intra-abdominal pressure, such as coughing and sneezing. When you do those things, urine may leak out. And then we have functional incontinence. This is the patient who has that lower urinary tract function, but they aren't able to get to the bathroom due to environmental barriers. Then we have bowel elimination. So normal elimination of the bowels or feces should be undue with no straining and no feeling of incomplete evacuation of feces. So constipation is the most common GI complaint, and fecal impactation is a major complication of constipation. So basically, this is a paradoxical of diarrhea where the fecal mass is there, the patient can't push that out, but there is a leakage of diarrhea that seeps through. And then fecal incontinence. This is continuous or recurrent uncontrolled passage of fecal material for at least 1 month. There are more than 6.5 million Americans that have fecal incontinence that are afraid to address the issue with their primary care providers. Sleep. So we all need sleep. We all need rest. This is how we conserve our energy. This is how we prevent fatigue and relieve tension. So older adults, they need just as much sleep as younger adults. But when we age, sleep becomes more fragmented. We wake up a lot during the night and it's much lighter. So the common sleep disorders are insomnia. Insomnia is when the patient has the opportunity to sleep, but they can't. And this is usually diagnosed with 1 month of not being able to sleep consistently. We also have sleep apnea. This is when someone stops breathing during their sleep. We have restless leg syndrome, which is a neurological sensation of the legs that disrupts sleep. And then we have rapid eye movement sleep behavior disorder. So this is pretty much a complex behavior that causes the patient to have violent dreams. They may kick and punch in their sleep as well. So this disrupts sleep for a lot of elderly. And that is known as RBSD. Now we're going to discuss skin problems. So there are many skin problems that are seen with the aging. They can be compromised by health or mobility limitations. So the number one mobility limitation skin issue is decubitus ulcers. This is caused when patients are sitting in one place for too long period of time. They develop these pressure sores. So basically, this can be even very hard to treat wound-wise when there's also some bowel and urinary incontinence as well. We have xerosis, which is dry, cracked skin. Pruritus, which is itchy skin. Seborrheic keratosis, which is benign growth of the skin, usually seen on the trunk. Herpes zoster, which also known as shingles. It is a viral infection that causes painful blisters. And then cancer. So cancer can be caused by too much exposure to the sun, tanning beds, and even carcinogenic material to the skin. And the last thing we're going to discuss is foot care. So feet influence one's physical, psychological, and social well-being. There are many foot irregularities, and they are inherited. They can be inherited, while others are caused by wear and tear, certain disorders such as neuropathy, or altered foot integrity. So we have common foot problems are corns, calluses, and bunions. These pretty much are abnormal growths that become very painful. Usually the bone may push up against the shoes or cause changes in that nature. And then we have hammer toes. There's a picture of a hammer toe, and it's pretty much is a claw-like appearance of the toe. And this limits one's ability to walk. And then we have fungal infections. These may not be painful, but they do cause a yellow or brown discoloration of the toe, and they aren't pleasant to look at physically, and they are very hard to treat. Next, Reiki is going to talk about the nursing interventions.